Good morning, everyone. Yes, I'm father of R2gate, and Dr. Park is grandfather of R2gate. So, yes, today's my agenda is the R2gate, the second years. So prior to talk about the second year R2gate, I would like to review the first year of the R2gate. Yes, last year we mentioned about these three categories. One is basic principle of the R2gate, and second is using the R2gate, we can do the virtual surgery. And third, finally, we can make a one-day implant concepts. So, briefly say, the basic principle of R2gate is this: CT scanner, CBCT scanner, and the model scanner. It called we as STL files. So, basic function is simple. Using the R2gate, we can merge CBCT and STLs. So, finally, we made a very characteristic images. And then, we uploaded the final restoration image like this. Using this, we can do everything before surgery. So, use your mouse, you place the implant simply like this. After that, we immediately, this file put into the CAD/CAM systems, and we draw all of systems which we want. And then, this system put into the CAM systems. So, using the milling or SLA, we make all of component, stent, provisional restoration, or customized abutment. After that, we started the one-day implant. Yes, this case is the first case of our team, Eureka R2. So, I would like to show very briefly what is a one-day implant. So, this patient is expected to the extraction and immediate implant placement. So, before surgery, patient visit, we take a CBCT like this. And then, take impressions. Yes, we recommend the alternate impression and full arch, upper and lower impressions. And at the time, we used the digital shade guide. After that, using the R2gate, we make the virtual surgery like this. So we place the implant. And then we made this three component before surgery. Yes, it takes only 1 week, and then we started the surgery like this. So extract the tooth and place the R2 stent in the operation site and pick up the drill, and then just drilling according to the R2 stent. After that, we place the very special picture, aneurysm pictures. And then we check the initial stability, and if we obtain a very favorable initial stability, we connecting the customized abutment, zirconia customized abutment, and then, yes, we manage sometimes soft tissue management. After that, we connecting the final restorations like this. This is our dream, one-day implant. Usually, this is finished in 1 hour. Yes, this is 5 months later. Yes, result is very nice. Yes, so we called this concept as a one-day implant. And for a one-day implant, you need a R2gate and a special implant aneurysms. Yes, of course, many other companies service like this stent or provisional restoration or customized abutment, I know. But their procedure is very complex. So, for example, this is the one company of the world. Yes, first visiting, they take an impression and then make a stone models like this and wax up using the hand. But we using the digital technologies. And then they make another wax ups for radiographic stent and duplicate this wax up as a radiographic stent. After that, patient visit again and take a CT twice times. They called this procedure as a double scanning procedures. After that, using the software, yes, our software is R2gate. Using the software, they do the virtual surgery. Yes. After that, they make the surgical stent like this. Usually they made manual method. And when customer need a prosthesis, they do these very complex procedures, dye surgery, model surgery. They cut up the model and put in a lab analog and put in a gum and put in a stones. I think this is the very, very complex and stupid things nowadays. After that, they make a customized abutment and provisional restorations like this. And third visiting time, they do the guided surgery like this. And they have the metal sleeve and the drills. It means if you're drilling, you have to change the drill and you have to change the metal sleeve. Yes, single is okay, but multi-case also, this is very complex. So, let me show you briefly all of the procedures. So, in other company system, first visit, they make models, and before the double scanning, it takes almost about 2 weeks. After that, CBCT scanning and diagnosis takes 3 days, and make a stone cast and make a provisional restoration or customized abutment. It is also take 2 weeks. So totally, it takes 1 month. And third visit, patient receive the implant therapy. Compared to this complex procedure, our system is very simple. So when they're first visiting, we take the CBCT and R2gate impressions. After that, using the R2gate and CAD/CAM system, we make all of this component in 1 week. So using this procedure, we eliminate all of these procedures. After that, second visit, we do the 1-day implant surgery. And it takes only 1 week in Korea. To make worse, the price is surprising. Other systems' price average is $600. But many clinicians want to do the guided surgery, but they don't use the guided surgery. Reason why it takes the time and high price. So we offer minimal time consuming and very reasonable price. So go to the booth and consulting our dealers. Yes, through this, we can do from single to full mouse case. I show you the full mouse case very briefly. So using the R2gate system, we place the 18 implant like this. After that, we made a provisional restoration and CAD/CAM provisional restoration and customized abutment and stent also. All of these procedures done by the CAD/CAM systems. After that, we started the surgery like this. So in the morning time, we done mandibular surgery, and after afternoon time, we done the maxillary surgery like this. So one arch takes 2 hours because placing the implant is 1 hour and connecting the provisional restorations takes 1 hour. So if you spend 4 hours, you make a full mouse 1-day implant. Yes, this is the result, and 2 weeks ago, we finished the final restorations like this. It's very nice. Yeah. So, during the 6 months, 888, this aneurysm implant placed using the R2 stent, and among those, 547 pictures done by the immediate loading, and the rest of them applied to the conventional loading. Yes, so it means using R2 stent, 62% customer challenged the 1 day and the immediate loading, yes. And the implant surgery site is very various. So not in only single, but they use the pull arch, and multiple case is the large ratios. Yes, and posterior, anterior is also. So in anterior region, many customers use the stent because for the best aesthetic result, implant 3-dimensional position is very important. So even though they place the single implant in anterior, they use the R2 stent very usefully. So last year, we mentioned the virtual surgery and optimal implant position and the one-day implant. Yes, this is the review of the last year. Oh, sorry. Yes, through this, we can make the number one. One means one-time visit, and it takes 1 week. And through this, we can do one-day implant. Yes. So because this is based upon the true digital technology. We don't use the manual technology. After scanning, all of our procedures done by the digital technologies. And I'll show you the R2gate second years. Yes. This is the key factors of the this year's R2gate. Yeah. So, to talk about the second year of the R2gate, yes, the key word is evolution. We are going on evolution during 10 days. So, this year's keyword is this. First, convenience. Second, digital eye. And third is sterilization. This is a newly coined word made by me. So Sean talk to me. This is the Kinglish. Yes. And fourth is the facial analyzer. So let's look over these four categories. So yes, first, convenience. Convenience. So actually, last year's version is a little bit impatient, and all of items made Korean world. So we renew our systems. And finally, we make the version 1.0. Yes. It looks very nice. Yeah. And we made a lot of intuitional user interfaces. So using this, you can more enjoy the R2gate programs. Yes, and second, this is very important factor, digital eye. Yes. Yes, from the user's feedback, we learn one important thing. When you're using the guide system, drill is entrapped into the guiding hole. So in the case, many customers feedback to me, during the drilling, I cannot feel the bone density exactly. So, as an inventor of the R2gate, I have to solve these problems as using the softwares. And I found the one important thing. When customer did not feel the bone quality exactly, the implant is loosening in 2 weeks. So our R2 team is concentrated about how to solve these problems. So my role is solve this problem using the softwares. So I found one thing, our human eye is not clever sometimes. Because our human eye distinguishes grayscale only 16 degrees. But in these CT films, 256 grade exists. So let's look at these circles. Can you distinguish the grayscale in this circle? Using my eye, I only see the only white colors. It means I cannot distinguish the grayscale perfectly. But if we coding these colors, we can distinguish color like this. So it means using these protocols, we can estimate the bone quality more intuitionally. So we called this function as a digital eye. So in R2gate, we made this UI, and you click these icons, you can see the city as a color-coded. For example, like this. Yes. What is this area? Where is this area? This is the soft tissue. hard palate soft tissue. And the soft tissue is consists of two colors, red and blue. Yes, it means red and blue is very soft. So, and then you can see the bone. Yes, also consists of the red and blues. It means this patient cancellous bone is very weak. So, using this, we can estimate the bone quality as a D4. And based upon this bone quality, we can make a drill sequence before surgery. Yes, like this. And about this drill sequence and how to get initial stability, talk about Dr. Lee, yes, and Dr. Chang-Woon. Yes, third important thing is sterilization. It is the key factor of our future regeneration techniques. So, as I mentioned before, we can make the CT as a color-coded CT like this. Using this, yes, look at this video. Using this, we can exactly distinguish the boundary of the bone. Yes, this patient boundary of the bone color is deep orange. So, using the R2gate, you click the deep orange color and click the OK buttons. After that, you can see amazing things. Yes. What's this? Yes, this is an S-terrifiers. S-terrifier means you can cut or draw and move anything. You can do that using the CAD/CAM systems. Yes, of course, I know. Implant service this. Can you hear me? Yeah. But they only charge money charged from the customer. But simply, we can service these functions. So, DICOM convert into the STL files. So I made these functions as called as sterilization. But I'm not good at English, so please, yes, tell the right spell about this. Sorry. But I want to call this sterilizations. Yeah. Yes, this is the key factor of the 3D bone block techniques. So once you change DICOM file into the STL files, you put in this STL file your CAD/CAM systems. After that, you can draw the bone, which we want, which you want. We call this is a customized 3D bone blocks. Also, this part will be presented by, yes, logo. Yes, and the fourth is the facial analyzer. Privately, I'm very interested in the full mouth reconstructions. So I think the ultimate purpose of our implant dentistry or dentistry is to recover the patient function and aesthetics. So for recovering patient function and aesthetics, not only small focus view is not needed. We also we have to see the very big, very huge images. It means the patient skeletal patterns. Even though we make a very nice porcelain or the prosthetics, it is not harmony in the facial patterns. It is very meaningless things. So, once taking the CBCT, using the CBCT, we can make a very nice diagnostic tools. So every cephalo or PA view is many kinds of lines because they shoot the one-shot radiography. But left and right face and front and posterior faces images is overlapped. So we cannot distinguish exactly. But using the CBCT, we can cut the image and we can get which we want images. So you can see the very nice and very clear images like this. Using this, we can make a more aesthetic and more functional prosthetics or implants. Yes. Yes, so this is the very important. And next year, we will show the amazing things based upon these functions. Yes. So our R2gate is going to the beyond the implant dentistry. The ultimate goal of our dentistry is our themes. Yes. So this year we showed these 4 categories and enjoyed this R2gate in our booth. This. And one more thing. As an inventor of the R2gate, I would like to, this year's version 1.0, I would like to dedicate to one person. Yes. Actually, he called as a little giant in Korea. So, yes. So, do you know these guys? Guess. Yes. So, I would like to dedicate this version to Dr. Bach. So he called this year's R2gate as a little giant. Thank you.
Thank you. Thank you very much, Dr. Kim.